Hello, I'm Jamie Bernstein. I'm the Executive Director of the Children's Commission, and I'm thrilled to be joined today by Holly Mims, the Director of Operations and Stakeholder Engagement at DFPS. And she's going to provide us with the Community-Based Care 101, a provider on the model and implementation. And I'll turn it over to Holly at this time. Thank you so much.
Hi, thanks, Jamie, and thanks for having me. And thank you for the opportunity to present this information. I wanted to give a CBC 101, Community-Based Care 101, that will lay some foundational information that will help build upon your knowledge of community-based care. Today, we will talk about the community-based care background. So how it started, how it's evolved, how Texas is implementing community-based care. We'll talk about single source continuum contractors. Those are our providers, where they are, where they're serving, what it looks like to be a provider. We'll talk about CBC implementation, and then I'll leave you guys with some resources that can that can supplement information that we share today that we go through, and ways to get in touch with us if you have questions in the future. So I like to kick it off with what is community-based care. Community-based care moves from an Austin-driven, one-size-fits-all approach to foster care and puts the onus of providing foster care services on the community. So there are benefits to doing that, where communities they build upon the local strengths and resources that they have, and they're allowed to be innovative and flexible. These SSCCs have the ability to contract for services that DFPS at times is unable to, or it may take time to do. We've seen SSCCs be able to be flexible and nimble in those sorts of ways, and that's just one example. So community-based care includes the provision of foster care services. In Texas, community-based care includes case management, and it's implemented in a staged approach, which we'll talk about soon. That's different than other states and different than the way Texas used to operate community-based care when it was known as foster care redesign. So at a glance, that's what community-based care is. The goals of community-based care are to increase the number of youth placed with their siblings, so keep sibling groups together and in their home communities, which will in turn hopefully keep children in their school of origin and address any of those gaps and breaks in education that we sometimes see as children and families experience the foster care system. We hope that, or the goal is that CBC will decrease the time that children spend in foster care because they're closer to home, because they're able to have those family ties and have those visits and receive those services. And also decreasing the number of moves that children experience while in the foster care system. Decreasing duration and intensity of services. If a youth or family doesn't need a high level service or a high acuity service, the goal is that an SSCC will have an array of services and an array of service providers to meet that exact need and not just apply the same, copy paste services to all that are experiencing the system. And furthermore, for that, creating a robust and sustainable continuum that will grow and support communities as communities evolve and as the foster care system evolves. The legal basis for community-based care, or CBC, this is a legislative mandate. So CBC is in statute, and it is the intent of the legislature for DFPS to contract with these community providers, which we call single source continuum contractors, and that they provide direct case management. The SSCCs assume all statutory duties of DFPS, and legal representation is provided in the same manner as DFPS. So our SSCCs are represented by the county attorney, district attorney, and so on and so forth. And we have some links here as well to statute. So I talked a little bit earlier about the evolution of community-based care. So community-based care, the idea for it started in 2010 when the public-private partnership was convened, and their responsibility was to create a model to improve the foster care system. The goals of CBC that we talked about earlier, those were experiences that children and families that were in the foster care system were seeing. So children were not being placed in their home of origin, placed far away from home, not with siblings. There were lost connections, there were education gaps, things like that. And so the public-private partnership, or the PPP, designed what we knew then as foster care redesign. So in 2011, Senate Bill 218 codified those plans for foster care redesign and allowed the department to move forward with the foster care redesign model. Now that model has since evolved. So that in 2017 through Senate Bill 11, the legislature allowed DFPS to further contract with these providers for case management. So in a couple of slides, I'll talk about the staged approach to community-based care that Texas is taking. But I want you to know that the model has evolved, and right now the model covers foster care services only. So it does not cover family-based safety services. It does not cover investigations. Those stay with the department at this time. So what is an SSCC? So it is a single contractor in each designated community area or geographic area that creates a network of services, which include foster homes and other living arrangements. And then when they're ready, when they move into stage 2, they provide case management. So CPS and DFPS as a whole works closely with each contractor to carefully manage that transition from traditional foster care to CBC. So this map shows where our current SSCCs are, and in a little bit, we'll talk about what stage they're in. So there are 2 paths to becoming an SSCC. You have what I refer to as the traditional path, so the request for application, the RFA process. So usually once or twice a biennium, we HHSC and DFPS work together to post an RFA for a specific area to implement CBC. So typically that has been following the geographic boundaries of the DFPS regions. And typically we posted for more than one at a time. And so DFPS says where CBC will be implemented and says when it will be implemented, post when the RFA is posted, when the RFA is pulled down, evaluation and all that kind of stuff. Now that's pretty planned out, and I'll show you our plans for the rest of the state for when we plan to release these RFAs. But at any point in time through Senate Bill 1896 in the 87th legislative session, DFPS is now allowed to receive unsolicited proposals. So at any time, a would-be, a vendor that would like to become an SSCC can put in their application to be an SSCC. It can be for any area in the state, so long as it's not currently served by an SSCC. And it doesn't have to follow the geographic boundaries, as so long as the counties are contiguous and they are encouraged to keep the judicial boundaries and districts together. Regardless of which path an SSCC application comes in, the evaluation process is the same. Same criteria to become an SSCC that's in statute, and the same evaluation process. So we've had a couple of unsolicited proposals. In fact, and the end of 2024 in the fall, we had 3 unsolicited proposals for the Region 7A area. And because it was obviously competition for that area, we let the vendors know that we would be putting up a request for application, so a formal RFA for that area to allow for that competition. So, oh yes, and then a requirement that's important to note is that the applicant must be a nonprofit with the majority of the board residing in Texas or a governmental entity. At this point, all of our SSCCs are nonprofits. We do not have a governmental entity serving as an SSCC. Now I want to talk about the CBC contract. So we talked about the goals of community-based care, and our CBC or our SSCC contracts are performance-based. So the performance measures tie back to those goals, to child safety, permanency, well-being. And then through each stage that an SSCC moves into, there are additional measures applied. So stage 2, In stage one, the SSCC is responsible for building up that capacity, building up those service providers. In stage two, the SSCC is responsible for all of the performance related to case management and serving youth and families experiencing the foster care system. And in stage three, statute allows DFPS to apply fiscal remedies and to give fiscal incentives for performance. And we'll break those down on the next slide. I did want to note that the monitoring and oversight for these contracts is comprehensive. We like to say that there's a multidisciplinary team approach to this monitoring and oversight. Each SSCC has a contract manager that is responsible for ensuring that the SSCC meets their contractual duties. There is monitoring that's done every quarter. There's annual reviews within that monitoring. There's a whole lot of effort put into monitoring just by that one individual and their management and their team. Additionally, each SSCC has a community-based care administrator or a CBCA that helps serve as the intermediary between DFPS and the SSCC. Really helps during transition, ensures that policies are applied, that if there are any differences or changes that need to be made to support a community for different processes, that's put into place. They're really somebody that the SSCC can go to with questions, that DFPS can go to with questions for the SSCC as well. With these performance measures, there's a lot of tracking, a lot of data that is looked at and reviewed. And so our data team, our Office of Data and Systems Improvement team, support each SSCC and DFPS as well. And last not least, and not the final piece to oversight by any means, but each area has case management oversight staff or CMO staff that are the designated case readers for these SSCC cases. So they have access to the cases that an SSCC is assigned. They get a certain number of reads per month. They track, they review, they offer technical assistance when needed. They're really there to make sure that the measures are being met, that the cases are being documented timely, just like in the legacy system. We have those QA staff. They're like QA staff for the SSCCs. And then I wanted to also mention that SSCC contracts are 5 years and have an optional one-time 5-year renewal. So an SSCC could serve a region for up to 10 years. And we saw that in Region 3 West with our community, our kids, who began serving when we had the foster care redesign model. So next, I'll move on to the stages of CBC implementation. So we've talked about how Texas is applying CBC in a staged approach. Other states don't necessarily follow the same path. Some do. Florida, whenever an SSCC or a lead agency goes live, they go right into case management. In Kansas, you'll see that the lead agencies also are responsible for what we know as family-based safety services. But in Texas, this is the direction that we're taking at this time. So at the bottom, you'll see a timeline. And this is a customary timeline, but this is a timeline that can be changed and negotiated with an SSCC and can be modified as an SSCC is moving toward the next stage of implementation. If they're not ready, if DFPS is not, if certain criteria have not been met, or if there are, red flags, an SSCC will not move into the next stage of implementation. So I just wanted to share that it is general. There at the bottom, stage 3 is the only stage that has a legislative timeline attached to it, and we'll get there. So stage 1 typically lasts for about 6 months. So prior to stage 1, we have the RFA, and I'm just going to go the typical route. So you have an RFA that's released, and there it says about 4 months. The RFA process takes a while, negotiation, contract formation, all of those things. So once a contract is signed, an SSCC moves into what we call stage one readiness. So readiness is a time period in which the SSCC is preparing, getting ready for the next stage of implementation. So for stage one, that means that they are preparing to take on the full continuum of paid foster care services, which include placement and the provision of PAL services and purchased adoption services. So they're building their networks, they're licensing homes, they're finding service providers and things like that, getting contracts with service providers. So when an SSCC is certified to move, readiness is certified, and they move into stage one, and we call that the go live. So they go live into into stage one. Then they are typically in stage one for about 6 months. Now, this is flexible. We've had some SSCCs in stage one for a year. We've had some for, less than 6 months. It just all depends on a variety of factors. The SSCC's experience of being an SSCC, how things are moving in the region as far as the transition goes, the number of network providers they're able to have on board, the number of staff they're able to hire. There are a lot of checkpoints to ensure that an SSCC is fully ready. In stage two, the SSCC is taking on the full foster care conservatorship case management duty. So that is everything that a conservatorship worker does with the FPS. That responsibility moves to the SSCC. So there is a lot that the SSCC takes on during stage two. So once readiness is certified and an SSCC moves into stage two, the SSCC has to be in stage two for no less than 18 months. And that's that prescribed timeline that I referred to for stage three. So an SSCC has to be in stage two for 18 months, and then they can move into stage three. Now, stage three includes everything that stage one and stage two requires of the SSCC, but it allows the DFPS, the department, to impose fiscal remedies and incentives for timely achievement of permanency for children. So any incentives that an SSCC earns for that, moving children to permanency in a timely fashion, they have to be reinvested into the program. They can't go to a paycheck. They have to be reinvested, and DFPS tracks the expenditures of those incentives. Okay, so I wanted to make sure. So those are the three stages, and we'll talk about, these are the stage two performance measures that I referred to earlier. So if you'll recall, stage two is case management responsibility. That's when we're looking at safety while in care, stability of youth in care, not moving when they don't have to. They're placed in home settings. We look for youth to be placed close to their homes with their siblings when they're old enough to receive those PAL services, for youth to be placed with kinship when safely possible, for youth that are of age to receive their state ID and driver's license, and to reduce the time in care and to reduce further intervention. So these are all of the performance measures for stage two. And if you recall, they tie back to the goals of community-based care that we shared at the start. So now that we have some information about what each stage entails, I wanted to pull this map back up and show you where our SSCCs are and what stage they are currently in. And this is as of January 2025. In Region 1, our SSCC is St. Francis, and they are in stage 3. In Region 2, our SSCC is To Engage, and they are also in stage 3. In Region 3 West, our community, our kids, OCOK, is the SSCC, and they are on two different timelines for implementation. I mentioned earlier that they were our SSCC during foster care redesign for the 3 West area, and that included the southern 7 counties of that region. So those counties are currently in stage 3, and the counties of Cook, Denton, and Wise in the northern part of that region are in stage 2. Region 3 East, our SSCC is Empower, and they're in stage 2. In Region 4, 4 Kids, 4 Families is our SSEC, and they are in stage 2. In Region 5, Texas Family Care Network is in stage 2, and in Region 8B, Belong is in stage 3. So I want to talk about moving forward, where we're moving next for community-based care. The blue areas on the map on the right are our existing CBC catchment areas. In green, you'll see those are the 3 areas that are currently in procurement. So DFPS released an RFA, a request for application for regions 6A, 6B, 8A, and 10 in March of 2024. Um, Applications were received for all regions except Region 10. Responses were received. So negotiations are currently underway with those 3 green areas, and we hope to have an announcement soon. So I'm going to skip down a little bit to the request for information line. So because we didn't have an application for Region 10, and because we hadn't had an application for Region 9 when we released our last RFA for 3 East, 4, 5, and 9, DFPS released a request for information to these communities in Regions 9 and 10 to ask stakeholders and providers for feedback to help us have an educated look at why CBC hasn't been successful, what the barriers are to CBC in these regions, and what would need to be different for these regions to move into community-based care. We received a lot of very good feedback, and we'll be releasing that feedback on our webpage so that the community can see what we are looking at and what we will be incorporating as we move to CBC in those areas. We also have entered into an interagency contract with the University of Texas at Austin for a CBC process evaluation to help us understand what's worked, what could be better as we have moved through CBC in our what I say in our areas that are in stage 3. So regions 1, 2, 3 West, and 8B. And it's going to look at the whole process from stage 1, from startup for stage 1 readiness, all the way to moving into stage 3. And so we're really hopeful to have some lessons to incorporate as we move CBC forward and mature the model. Our future procurement plan. So our legislative appropriations request for the 89th session includes funding for regions 7A, 7B, 11A, and 11B for that request for application. So should that be appropriated, we will be posting RFAs for those 4 regions. And then I had mentioned that there was also an unsolicited proposal 3 received for region 7A. Okay. So actually from our December 31st, 2024 CBC annual implementation plan. So each year DFPS releases an annual implementation plan to say where CBC is going in the following years. And this is the visual from that last year's report, 24's report. And it shows what we are planning for moving implementation of CBC, what stages each area we're planning for them to be in. Now, this is all, as I mentioned on the slide with the stages and the timeline, this is all contingent upon an SSEC meeting requirements to move into the next stage. And this is our plan. But of course, this is contingent on a variety of variables. So in order to get a hold of that report that I just mentioned and a lot of other reports and to stay up to date on community-based care, we have our webpage. It's communitybasedcare.org. And on that page, there is a tab for news and information. Put your email, if you scroll down a little bit, put your email in. You subscribe to our Gov Delivery D-list. So anytime there's an update with community-based care, anytime a report is released, it'll go straight to your email inbox. I really like that resource. We also have a concerns or complaints team that handles processes Any concerns related to community-based care or SSECs, and the email to that team is provided here. And also, if there are just general questions about community-based care, we have our CBC Care email. But of course, feel free to contact me. Call me. Here's my email. I am happy to answer questions, and I thank you for this time.
Thank you so much, Holly, for providing that overview. It's been very helpful, and I just want to underscore that this is a dynamic model. It's an iterative model. It does evolve over time, and I just want to encourage all of you, the attorneys and judges and advocates, to be involved in this process to help shape what community-based care looks like in your community, because your voice is very important in shaping the way this looks for you. And I want to thank you for your time.